speed is a great place for that. The grand tests were actually, I actually underestimated the grand tests. I attempted 30 out of the 32 grand tests in the app because it gets you in the right mindset. It gets you in the right mindset. So before the exam, if you're practicing grand test, you are ready for the exam. It's a two-way communication. Live lectures are two-way. The recorded videos doesn't inspire you to sit through the entire thing. But yeah, I took the subscription this year.
Bring in all the wishes and greetings on behalf of all the faculty members and Pete to Dr. Aswin for scoring a topmost rank of 269 in MCS surgical group for Super Speciality exam of NEET SS 2025. Congratulations to you, Doctor.
Thank you, sir. Thank you very much.
Great achievement. And also, I want to thank you for sparing your valuable time to share your experiences with us and to the students who are watching this video.
Yes, thank you, sir.
Great.
The honor is mine.
Now, can we have a brief background about yourself from where you started till date, what all you have achieved?
Sir, I did my UG from AIMS Bhopal, 2012 batch. Then I did my PG from Safdarjung Hospital, New Delhi. I passed out in 2022. I did an year of SRship. Then I worked in private for an year. Currently, I'm working as an assistant professor in Government Medical College in Kerala, my hometown. Yeah, so that's my background.
Great. Very nice.
Yes.
And
Yes.
wonderful accomplishment all through in top-notch medical colleges and institutions. And you achieved
Thank you, sir.
Great degrees and education and acquisition of knowledge, everything. Now, what is your
Thank you, sir.
top choice?
Actually, I'm interested in surgical gastro, sir. That was my priority. Second option would have been urology. But still, I remember you in your class, you were telling you should always focus on the branch. First, you should decide the branch first and then work. So, surgical gastro is and has been my dream always.
Great. Very good choice. And I think you will definitely kind of make your dream come true. And we want to know from you,
Thank you, sir.
we want to know from you, what was your preparation strategy? What all you did? I mean, how you worked in the back end to get this rank in the front end?
Purely speed, sir, nothing else. Yes. So actually, with the workload that we had, I did not have much time to go through the books or any other material. It was just question bank from speed, the grand test in the speed app, and the lectures. That's it. Nothing. I didn't have time to do anything else.
Okay.
So that was. I think I started in June of last year, June of 2025, and 6 months. Yeah, that's all.
Great. How you got into speed? Who introduced speed to you?
During COVID time, during my postgraduate, that time I actually have heard the name. I had heard the name from my batchmates. But yeah, I took the subscription this year.
So because choices are many, then why speed? I mean, why you
Uh,
felt speed was good for you?
Sir, actually, during my PG days, I've seen your one of your video from my friend's app. I think the level of motivation that you brings uh, into the training program, it's not about the exam. It's not just about the exam. The excitement that you bring to the topic is something that I felt is not available anywhere else. And the live lectures. I don't think I could. I think there is no other place where you get live lectures during the course of preparation. I think that is very important because it's a two-way communication. Live lectures are two-way. The recorded videos doesn't inspire you to sit through the entire thing. So the live lectures actually would be the first thing, and second will be user.
Great, great. Thank you for sharing. Doctor, how many questions were you able to attend this exam?
I think I attended, sir. I think I skipped only 5 or 7 questions. I think 7 questions I have skipped, sir. I haven't gone through the answer key, so to say. So I'm not sure how much I scored. I think I scored 423 marks, sir. So I'm not sure how many negatives I did, but I think I attended almost, apart from 5 questions, I attended everything. Yeah.
Okay, okay, doctor. Now, what is about the paper? Your opinion on this paper?
Um, uh, Little more towards the CVTS side, so to say, sir, than usual. and more, I think basics were more focused rather than hi-fi things. Not too much like protocol-based things like they asked for INICET. It was on all basics. I think they have stuck the standard books, but I think bit more towards Schwartz and Sebastian than Bailey, I would say. I have given the exam once before, sir, and it was I got 1,000 rank. And as compared to that paper, this was much more towards the basics, I feel.
Okay. Thanks for sharing. And what is your
Yes.
advice for the future aspirants of MCA Surgical Group?
Uh, I don't think you should over prepare. Stick to one thing and revise more rather than going here and there. I think I had suspicions for many apps in the past. So I used to juggle from one app to the other during my last preparation. I think that's a waste of time, and it's not possible, especially if you're working. If you're working, then you should stick to one thing and you should revise. I think focus should be on revising what you learn, because as such the amount is vast. The amount of material is vast, so you should stick to one thing. And I think speed is a great place for that. The grand tests were actually I actually underestimated the grand test, so to say, sir, because grand test actually comes in handy. I attempted 30 out of the 32 grand tests in the app, and I think that made a huge difference. Yeah. Because it gets you in the right mindset. It gets you in the right mindset. So before the exam, if you're practicing grand test, you are ready for the exam.
Thanks, Doctor. I mean, for sharing, because it will be useful for the students because you followed it and you did it
Yes.
so that it could be
Thank you, sir.
useful for them.
Sir, if I may, can I say one thing? I got 100 rupees from you, sir, once, and that was also a motivation during the
I
live
would
lectures.
have said something along with that. After giving 100 rupees, I would have said something.
We will meet you. I will meet you in the interview, post interview, exam interview. You said that also, sir.
Because
And it came true.
those students who got money have always been successful in the exam, and I'll make an interview with you. Shall I share
Thank
something
you,
with
sir.
you? Can I say something to you?
Yes, sir. Yes, sir.
Because you're all very dedicated for a live class. All those students who were with me in the live class, I have interviewed everybody today.
Yes, sir.
You're able to understand what I'm saying? All
Yes,
those
sir. Yes, sir.
met in the live sessions of my classes. I have made interview yesterday and today, and I'm making tomorrow.
Thank you, sir.
It's
Thank you,
not
sir.
about my class, it is about the dedication of the students who attend to the class. Those who showed up,
Thank you.
that made the difference.
Thank you, sir. Thank you, sir.
Appreciate that sincerity and dedication that you showed up to that. And that's the reason why we are here today. Great.
Thank you, sir.
So now, time to thank, and whom all you feel that they stood by you from day one till date. You feel that to thank them.
Uh, sir, no, the list is actually very large, but I think
Yeah, you can do it, no problem.
special thanks to my colleagues for understanding that I've been doing this, especially the department HOD, who was lenient enough to give me some workday off so that I can prepare and also give the exams, especially given the workload is that much. And also to my parents and to my wife. But from day one till at least 7 days before the exam, sir, you were there. You were there with us. So special thanks to that, sir, because nobody else has done that. In other materials also, the actually the pre-recorded videos, it doesn't pull you. It doesn't keep you in the class. When your live lectures were there, and I remember revising the Sebastian live lectures that you took. I was just going through the materials, the ones that is scribbled in the side and the PDF that's there in the app. So I think that's actually a really good tool to revise. Again, underestimated from my end, but the last minute it came through. So thank you, sir. Thank you for that, sir.
Great, doctor. It was a very, very good interview with you today. And
Thank you, sir.
and I wish you once again a great career, wonderful career as a gastroenterologist. Yes.
Thank you, sir. Thank you very much. Thanks. Hope to meet you, sir, in person once.
Sure, 100%. Wish you all the best and all the success.
Thanks. Thank you.